There is a saying that not all heroes wear capes. Well, our generation has seen many of those, but particularly this year, we've seen some warriors in our midst, with just face masks, face shields, carrying hats and helping hands, who stood firm to fight an invisible enemy. At exactly 12 p.m. on Friday, as the midday scorching sun shone across Rwanda, millions of people stood at their front doors, in gardens, on balconies, to raise a thunder of gratitude to those working on the front line of the fight against coronavirus. For the first time, the high-spirited din of hand-clapping, cheering, hoots and whistles resounded along streets that had been weirdly quiet for most of the days since the country went into total lockdown to prevent the spread of the deadly coronavirus pandemic. With the hashtags Turashima and Tuzatsinda, loosely translated as "We are thankful and we shall overcome," trending all day on social media, the nation paid tribute to health workers, security organs and volunteers who have worked day and night to see the country rigorously fight against coronavirus. Fiona Kamikaze Rutajengwa, a social media influencer, is one of the people behind this initiative. She says the idea was inspired by the selfless service of the National Coronavirus Task Force and health workers treating those infected with the virus.
Iki gikorwa ni ingenzi kuko aba n'abantu bigomwe.
It is important to be thankful and show gratitude for the people who have risked their lives to save us. We have been asked to stay at home and away from anything that can bring us close to being infected by the virus. But there are people among us who are out there on the front line fighting this pandemic and caring for the sick. The unmatched selflessness of the health workers has been on the lips of everyone during this period, especially those seeking health care. I can't describe the work of our nurses and doctors. The care, the courage in their services is unmatched. They have the right to stay at home like everyone else, but because of their caring hearts, they risk their lives to save lives of Rwandans. For Mazuba Agatha, a gynecologist at Kibagabaga Hospital, being a health worker is a calling, a duty she believes calls for courage and sacrifice, but with immense emotional reward when a life is saved, especially during this period when the world is grappling with COVID-19 pandemic. We work in shifts, as it has always been. Sometimes we work overtime. The challenge we are experiencing currently is transport, to be able to get home in time to rest. Public transport means and taxi motors are on hold due to the lockdown. But our work has continued as it was. However, we are paying extra precaution to avoid being infected by the virus. A lot has changed, but it is understandable. We're experiencing unusual circumstances, and we have to pay attention to the guidelines put in place by the Ministry of Health. Some people work overtime, but they are flexible. They understand. In the emergency ward, we receive people with coronavirus symptoms, and we don't get to know that they are sick until they are tested. That exposes us to the risk of being infected, despite having all the personal protective equipment provided by the Ministry of Health. Dr. Biringiro Jean-Claude, a chairperson of Rwanda Medical and Dental Council, told RBA that health workers are happy to spend sleepless nights during this difficult time. Seeing the numbers of new infections reducing and recoveries increasing is something we are all proud of as health workers. It is a testament of professionalism among our people and everyone involved. The Council has prepared for all the possible scenarios, but we are glad to see reduction in new infections and increase in recoveries. We are moving in the right direction, but we are also ready should the situation get worse. In Rwanda, the ratio of doctors to patients is 1 health worker per 9,000 people. This has improved from 1 health worker to 10,055 people in 2016. The government has set a target of 1 physician per 7,000 people ratio before the end of year 2020. Eliazar Ndabarora, a medical professor and an expert, says that Rwanda has made commendable strides in the health sector in recent past. We have made commendable progress, but we are far from being where we want to be. I'll give you an example. The government has set a target of 1 physician per 7,000 people ratio before the year of 2024, up from the ratio of 1 health worker per 10,000 people. There's still a gap of World Health Organization recommendation, which sets a minimum of 2.5 health worker per 1,000 people. Rwanda has 21,552 health workers. They include 1,521 doctors, making up 70% of the entire sector population, and 15,050 gynecologists, who form 70% of health worker population. Meanwhile, nurses and gynecologists increased by 108% since 2005. Health workers are expected to increase by 64% in Rwanda by the year 2024. Reporting for RwandaTV News, Athan Tashobya.